Right, hello and welcome to Hello Malaysia, and I am your host Suryati Sanusi, and today we're talking about Stand Up to Cancer in conjunction with World Cancer Day, which falls on 4th February every single year. Now, today in the studio we have Dr. Santari, which is the President and Medical Director of National Cancer Society Malaysia, and also Lina Abdullah, who is also a cancer survivor. Yes. Plus, she is also the Vice President of Pink Unity. Now, what Pink Unity is all about, or what National Cancer Society is all about, we'll ask our guests today. And before that, I would like to welcome both of you to the studio, and thank you so much for being here. And we'll talk about World Cancer Day. Thank you so much. And right, before we start going to talk about what National Cancer Society is all about, let's talk about yourselves first. Let's ask Dr. Sandri a little bit on your background. We would like to know a little bit on you. Oh, and how did you get involved with National Cancer Society?
I got involved with the National Cancer Society about 14 years ago. That sounds too long now. Basically, it was more because of my mother, who has had cancer. And she's had cancer not just once, but she's had cancer about 5 times.
Right.
So as a medical doctor, I was actually doing pediatrics.
Oh.
But when you're a doctor, you're on one side of the bed.
Yes.
And when your mother's on the other side of the bed, you suddenly become a caregiver and you see medicine from a different perspective.
Okay.
And I think that's what made me got involved with the National Cancer Society, because the perspective I was seeing it as a caregiver wasn't a really good perspective.
Okay.
There was a lot of stigma with cancer. There was a lot of ignorance with cancer. And I thought that maybe I could do something to change that.
Awareness.
Exactly. And so that's why I joined the National Cancer Society of Malaysia.
Right. And you've been with National Cancer Society for how many years? 14 years? 15?
14, coming on to 15 years.
Right. And Lina, as a cancer survivor. But let's talk about you being the Vice President of Pink Unity. What is Pink Unity?
Okay. Pink Unity is a support group for women for all type of cancer.
Right.
For all type of cancer.
And they are survivors of
yes,
the cancer.
and all of them are survivors. All of them. So if you want to be a member of Pink Unity, you have to be a survivor. You see? And so far we have 300 over members, and which is around 150 to 120 active members.
Okay.
Yes.
So if it's for women, it's Pink Unity. For men, it's called?
Men, we have also under National Cancer Society is a prostate group, yeah?
Yes, it is.
Yes.
Right, and it's...
The issue with men, I think, is not many men come forward to talk about their
we
cancer.
discussed this before we
exactly.
went on air. So.
So we actually had a general cancer support group for men before, but we didn't get so many men coming to share
their
experiences. So it became more of a prostate cancer support group.
I see. Only for one specific cancer, rather than just having a support group for the whole men.
Yes.
I see.
Having said that, though, if a man comes and wants support, we still do provide support. We will try to get someone who has a similar type of cancer or a similar background to talk to them. Or if not, the prostate cancer men are very, very happy to go out and talk. A cancer experience, I think, there are points about the cancer experience which are standard for anybody, whether you're a man or you're a woman.
The emotional, the journey that you go through, I would think that will be similar. But before that, let's talk about what National Cancer Society Malaysia is all about. Why are they there? What are they giving out to support especially?
Okay. The National Cancer Society of Malaysia is the oldest cancer organisation in Malaysia. We started in 1966. We have 3 pillars in the society. One is education, which is very much awareness, driving cancer control in Malaysia. And then there's the care aspect of it, which is we actually have investigations. We've got clinics that you can go to. And the support. And the support is where Lina is integral. Exactly.
Right.
Pink Unity is integral in the whole support system. The support aspect of it only really started in 2002, 2003.
Just?
Yeah.
Okay.
Yes.
Because you have to understand, before that, there was such a stigma with cancer. Nobody would talk about it. If you had cancer, you didn't tell people you had cancer.
It's a big hush-hush.
Exactly.
Right.
The whole idea of talking about cancer was being fatalistic to a certain extent. It was drawing attention to yourself and bringing bad luck. We're quite superstitious about things. And if you talked about your cancer, a
It's
lot
like
of people
giving
thought,
bad luck to everyone.
exactly, you know, you had bad vibes. So a lot of people didn't talk about cancer. So when we first started it in 2002, we started the Resource and Wellness Centre, and it was a place for cancer survivors to come. Other than breast cancer, which was fairly more active,
Right.
it was the only place that anybody had. I mean, a woman
any
or
other
man.
cancers survivors.
Exactly.
Right.
So it started off very, very small, very slow, and slowly more and more people were willing to come up and start talking about their cancers.
Okay.
And I think a lot of people found it empowering. I think
Right.
that is
That's
the
the
whole
important.
part about a support group or a support network is how much it empowers you and how much you realize that you are not cancer.
Right. So I guess the support is, it's more healing than the medicine itself.
Yeah, exactly.
Right.
And it's the bonding, and also the bonding. And you see, 5.5 years ago, I joined this
Right.
support group, and no turning back to that.
Okay, but
Yes.
before that, let's talk about you. I mean,
Yeah.
as a cancer survivor, what you had before?
Okay, I had this what we call NHL, non-Hodgkin lymphoma.
Okay, which is probably for people out there who doesn't really
usually
understand.
only 3%. Yeah, Dr. Sam, 3% of
it's
women get it.
Really?
Yes.
Okay.
It's a cancer of the lymph node.
Okay.
Yeah.
Lymph.
And but not necessarily to be in the lymph node. Like
Okay.
mine, I had in my leg muscle.
Oh.
Yeah. You
Okay.
see? And it's a growth that you don't feel the pain.
Okay.
There's no pain. You see?
But how did you find out?
Because you can see it.
It's a bump.
Yeah, it's a bump. You can see it. It is exactly like this. It's hard.
Right.
It's hard and no pain. You see, and it start growing and then no pain. And then one day my husband said, "Hey, you must go and see a doctor." Okay, and go and see a doctor and remove it. But I know nothing about cancer.
Okay.
You see, you can read all type of books in your life,
Right.
but you won't read cancer book because it never click in your head
That you would
one
get
day,
cancer.
yeah.
But do you
I
have
know-
someone in your family who has cancer?
No, no.
You don't?
I don't.
Okay.
I don't smoke. I have a healthy life,
Right.
exercise.
You go running.
Yeah, so, and the first question you ask is, why me? Which I think
Right.
everybody
And what
asks.
did I do wrong?
Yeah, but
Right.
actually, is now and think about it, I laugh.
Okay. Why?
It's a really stupid question to
Okay.
ask why me. You know?
Right.
Because you can't find the answer.
Right.
It happened, you know.
But can we ask why me? You know,
Yeah,
there must be something
I asked
wrong.
the doctor,
Right.
why me? Why not these people who
Is there
kill
something
children?
wrong with my hormone
Yeah.
or something like that?
Yeah.
But the
The
answers
doctor
that you
said,
get
yeah.
is
It can happen to anyone.
right.
Whether you are strong or weak, beautiful or not, young or old, it can happen. Which is a good doctor will give answer.
Okay.
You know, they can't say, oh, because you do this, because no,
Right.
you can't. Yeah.
And they says, you know, most cancer patients, they're not genetically, you know, they don't say my family doesn't have that kind. Is it
Exactly.
true?
I mean, that's the myth. Everybody thinks that cancer is something that, because
You
you have
inherit-
something,
Yeah.
you inherit.
Yeah.
But it's not. We're finding more and more that only about 5 to 10% of cancers are inherited. And the other cancers, there are other factors which are related to
Yes.
it.
Yeah.
Now, for Lena's cancer, there are no real factors related to it.
Right.
There was just, unfortunately, I wouldn't say bad luck, but the probability that,
Right.
you know,
She had it, and she's among the 3%
Yeah.
of
Exactly.
people or
Yeah.
women
Yeah.
that would get it.
Yes.
Okay?
Yeah.
you know, non-Hodgkin's is something which happens in much younger or
Yeah.
much older
And men have
population.
and it's more.
Mostly.
Yeah.
Right. So when you got it, when you had that
Oh
when you
my
started
God.
asking questions like
Now when
that,
they ask about, I can laugh.
Okay.
Actually, really was scared. You don't know what to do, and asking yourself, what it went wrong? Why? You know, and then ask the doctor again. 4 doctor,
different doctors.
because you know
Okay.
your mind start playing you. You say, oh, maybe you know the doctor put somewhere and it was
Misdiagnosed
somebody else
you.
one. You
Okay.
know, but actually you have to accept the fact.
Right.
But the doctor told me on Thursday, that means I have Friday and Saturday to ask any other opinion. And
Why? Why do you have that?
because I feel that, oh, maybe it's wrong, maybe I should ask another doctor, you see. Monday, 3 days, take me 4 days to decide whether I should go with the operation or not.
Right.
And that's all.
What was your diagnosis? What they suggested you to do?
That by Monday, I must come to the hospital and start doing chemo.
Right.
4 days.
And for
That's
that kind
all.
of cancer, is it fatal? Is it
If it's in the late stage,
It can
yeah,
be.
yeah,
it can be
late
fatal.
stage. Yes.
Okay, so
Yeah.
you caught it
Yeah.
in the early stage.
Yeah, so that also because I don't want to wait, because I
Okay.
want to live. You see, some people, when the doctor tell them today,
Exactly.
it will take 1 month, 2. We had people in
I
our
mean,
group,
right.
yeah.
For
Okay.
Lena saying 4 days,
Right.
4 days.
that's a
That's
short
the
period
shortest.
of time.
Okay.
Most people would go back
Yeah.
and see, as you said, 4 different doctors, 5 different
yeah.
doctors, go and seek alternative treatments. and
That's the first thing they will do.
Yes.
Alternative
Exactly.
treatments.
Yeah, 4
Or-
days also. That means Thursday, doctor told me. That means I have Friday and Saturday
To decide.
And Sunday was public holiday. It's holiday, and I remember Monday was public holiday also. But
Right.
yet still, doctor say you can come on Monday.
Okay.
You see, that means 4 days.
Right.
And where
we,
doctors sound
we wish there were more people like
yeah,
Lena.
it take months, and by the time they go back.
What do you say about people who are seeking medical alternative treatments rather than just go and start doing whether it's chemo or operation? What do you say about that?
I think at the end of the day, a patient has to make their own choice.
Yes.
It should be an informed choice, though.
Okay.
So an informed choice is that they should talk to their doctor, they should talk about the options, to learn about the disease a little bit more, and not let fear
Take over.
overtake.
Yes.
And I think that the reason why a lot of people go for alternative treatments first is because of fear.
Okay.
Because one of the stigma of cancer, and I think studies have shown that people have more fear of treatment, especially chemotherapy, than they
Right.
have of the cancer itself.
Right.
Because there's so many bad stories
Yes.
about
About
chemotherapy.
chemo. It's not only stories. We see on movies. They
Yes.
start
Exactly.
vomiting, losing their hair. I mean,
true.
like Lena told me, you do lose your hair.
But you look at Lena
Yeah,
now.
it's
Right,
true,
she's
but-
laughing and she looks
Exactly.
very healthy.
Actually, that's the truth. I told my friends and even the doctor, I said, cancer would not kill me, but the fear of having chemo, because I don't know what chemo is.
Okay.
I really don't know. I never see how it looked like. I
Right.
thought it was some kind of gas or something.
Okay.
And actually, when I look at it, it's only a fluid. And
Okay.
all this while, I was thinking, because people keep on telling you, don't take chemo. Somebody
Right.
took chemo and died.
Right.
Don't take. So your mind is
Stop
wondering,
playing
what is this
around.
chemo all about? And the nurse, when they come and give you the chemo, they didn't tell. They wrap the thing, and it look like a bomb. Yeah. And now I can laugh.
Right.
Yeah.
And this was what, 4, 5 years?
5.5 years ago.
5.5 years ago. And you still take chemo now?
No, no more.
Okay.
Only
So
for the first 6 months.
How many? It's only 6 months.
6 months.
And what is the results of after the operation? You did an operation
I
as well,
did
right?
operation first, remove, and then take chemo for 6 months. 6 to 8 months, every 6
It
weeks.
depends.
One chemo every 6 weeks. No radiotherapy,
Right.
and no medicine after that. And
Right.
Okay.
So the only after effect that you have, you started falling.
Hair, yeah, that's all. But
That's it.
hair can grow.
Right, but
You know?
you weren't vomiting. You were not, fainting here and there like
I
we
was
see in the
expecting.
movies.
Yeah, I was expecting because I heard so many things what people say.
And some say people get seizure as well.
Yeah, I was
Exactly.
waiting for the pain. Didn't come
Right.
yet. Even my children, they asked, how is it? Oh, no chat. Maybe next.
Maybe tomorrow probably.
Maybe next chemo.
Okay.
And actually, no.
Nothing happened.
No. It-
Your appetite, nothing
no.
changes.
Actually, also the best medicine is your mind.
Okay, so
Yeah.
start telling
Yeah,
yourself.
because I want to live.
Okay.
I want to live. After taking chemo, and the next day I rest, and after that I wear scarf and I go to market.
Right.
And I do all the housework.
Right. Do you still
Everything.
continue exercising
Yeah.
as you did
Oh,
before?
malah already.
But when you were having chemotherapy, but did you do
No,
some
my
light
exercise is
exercises?
cleaning the house, looking after
Okay.
children, send them to school and pick them from
Right.
school, you see.
Okay, Lena mentioned chemotherapy and radiotherapy. Probably, doctor, you can differentiate the both.
Okay, there are 3 different types of main treatments for cancer. One, of course, is surgery, then radiotherapy and chemotherapy. Surgery, of course, is taking out the tumor
Yes.
itself. Radiotherapy is X-rays,
Okay.
basically high dose X-rays to actually kill the cells,
cancerous
the cancer
cell.
cells. Radiotherapy is what we call local therapy, so it's directed to where the cancer was.
Okay.
So if you have breast cancer, then it gets directed to your breast. So it's not a whole body treatment.
Right, only at the
It's
certain
just at the
places.
area where you might have done the surgery or where the
Right,
cancer is.
right.
Now, chemotherapy is what we call a systemic treatment.
Okay.
A systemic treatment means that it's whole body treatment.
Okay.
And why it's whole body treatment is that the fear is, for certain cancers, especially in late stage cancers, is that the cancer cells have moved from the area where it
Let's
started.
say it's from the leg?
From the leg, it's
Right.
moved somewhere
to the
else.
lungs and what?
Exactly.
Right.
It can move in different ways. It can move through your blood.
I think the cyclist, Lance Armstrong, he
yes.
had that, I think. The
Yes,
cancer
he did.
moved.
He did.
Right.
He had testicular cancer. It went to his lungs, it went to his brain, it went to his bone.
Right.
The wonderful thing about testicular cancer, and I think that shows real survivorship, is that if you get treated with testicular cancer, even if you're on fourth stage, late stages,
Okay.
you still have an 80%
survival rate.
rate.
Wow.
So it's
Okay.
huge.
Wow. Right.
Not all cancers are like that. With
Okay.
breast cancer, you're looking at fourth
Yeah.
stage at 20% if you're lucky.
Okay.
Lung cancer, you're looking at 2-3%
Yeah.
if you're very lucky.
Right.
So getting the cancer early is very, very important.
Right.
And treating the cancer well as well.
Right. And
is
according
equally
to
important.
what's necessary between radio or an operation or
Or
chemo.
the chemotherapy.
Okay.
And with chemotherapy, as Lena said, chemo affects different people in different ways. Some people have minimal effects, like Lena,
Lena.
except for the hair,
Right.
and some people don't. And
Yeah.
But I think your mind over matter
Yeah,
makes
it's
a difference.
important. Okay.
The type of chemotherapy, of course, makes a difference because you've got 100 different types of drugs, and it depends on the cocktail of drugs that they decide to use for
On
you as
you.
well.
Okay.
And that also depends on the stage of your cancer.
Right.
If you're in earlier stages of cancer, you might not have to use as strong chemotherapy compared to later stages of cancer.
Okay.
So all these things make a difference. However, I think in terms of mind, a lot of people think that once you have cancer, you're an invalid.
Right.
You're straight away put into this little
you're there.
box.
You're in
Exactly.
coffin.
Death
The next thing
sentence,
is in
yeah.
the coffin. Okay.
So, you're supposed to stay in bed. You're not supposed to do work.
and look sick.
Exactly.
Right.
Everybody comes up to you every day and asks, how
Are you okay?
Are you okay?
Did you have that? Did you have that?
Exactly, that's what I thought. I said, oh God, I'm going to get a new curtain. People are coming to visit me.
You're thinking about your curtains.
Yeah, because it's like eccentric. I must have my house clean,
Cleaned.
things like that.
Right.
No,
So there's no pain. There's no nothing.
no.
Right.
Just tired.
Okay.
Once in a while you feel tired. Not all
And the
time.
tightness is because
The tiredness is because of the chemotherapy,
Yeah.
because it's suppressing
Yeah.
the cells in your body, basically. Because
Right.
chemotherapy, as I said, it's systemic, so it's whole body.
Right.
So it just doesn't affect the cancer.
Okay.
It affects other aspects of
Right.
your body as well. But as Lena said, after you finish the chemotherapy, after a month, 6 weeks, your symptoms disappear.
Okay.
And everything goes back I wouldn't say to normal, but everything starts working
Back
basically
as normal
back
as-
as it used to.
Okay, all right. We have to go for a short break, and when we come back, we'll talk more on World Cancer Day right here on Hello Malaysia. And welcome back to Hello Malaysia with me, Sue, Elena, and Dr. Sam from National Cancer Society of Malaysia. And before we continue talking to them, we have a clip of the NCSM on what they do over there, and some of the cancer survivors are giving some their comments on this. So let's take a look at the clip right now.
Well, that is not the end of the world. There are great doctors out there, Have faith, pray, and live happily.
If you detect it early and you treat it early, I think there is a good chance of survival.
Then when they go through treatment and then when they become part of this big family here where they participate in the classes and all, you see the turnaround. They seem to not fear cancer as they did when they were first diagnosed.
At NCSM, it's wonderful. They organize a lot of talks, health talks, knowledge talks, how to, make ourselves feel better.
Oh, I've never been better. Yeah. Cancer has opened up new experiences for me.
I get to do what I want to do.
My dream would be to see us provide a wider range of support.
My dream is to see NCSM come up to greater heights, to be an advocacy place where we advocate for patients. We are wanting more people to come and help us. I want to see cancer in the national agenda health plan. And I want to see that government gives us more budget to do our work.
My dream is for National Cancer Society of Malaysia to be acknowledged as the leading cancer NGO in Malaysia. And we would also like to get more people to come in for screening to ensure early detection and treatment. Giving hope, celebrating life.
Right. And we saw a lot of cancer survivors, they give their comments and they look very healthy, you know, they're very happy. Is that what the support does to people?
Yes, it's a peer support. We want them to be happy. We want to tell them there is life after cancer.
Okay.
You know, we want to reach them, you know,
Right.
because sometimes they feel that, that how I feel before loss. And people can come to me and talk anything about cancer,
Right.
but I want to see the living proof. I'll ask my husband and say, show me who survived 5 years. Show me, you know.
Okay.
And when I went to NCSM and I saw people walking 10 years, 15 years,
Okay.
18 years of survival.
Right.
And then I said, oh, okay, so that's it.
Right, but
know?
the survivors, I think they survived. They went through. They're strong enough, you know. But how about the ones that just got to know that just had cancer? So what kind of help do you give these people?
Okay. First, they can come to NCSM, our wellness center. They can ask about, from the doctor, they can ask the doctor sound itself or another doctor downstairs, whatever opinion they want to ask, whatever.
Okay.
And then for us, we can only give peer support, meaning we can tell them that we'll be there if they need us.
Right.
If they need us. We
Okay.
don't go and disturb them
Right,
and bugging them, you know,
okay.
because our society sometimes when they know somebody with cancer, they're
Get very nosy.
Yeah, they're caring,
Right.
but sometimes over caring.
Right.
You know, but yet at that time, these people need to be by themselves, or maybe they need to be with
What do
their
you
family.
think? Do they need to be alone or do they need support around them?
They need support, but first few days, I think they need to be by themselves
Yeah.
first.
Right, just
we don't go buzzing
Let
and
the
say,
information, you know.
yeah, because they're at a state of shock.
Okay.
And all of a sudden, so many people go in and ask them
"Are you
why and how,
okay?"
and of course, it scare them off. They will
Right.
think, I'm going to die, and so many people come and visit me today.
Okay.
You can imagine when someone gets cancer.
Yeah.
You've got your doctor talking to you.
Okay.
Then, of course, you've got your family members. And then you've got concerned friends
Right.
who
And
will
you
then
got
invite...
stories after
yes,
that.
who will then invite other people to come to talk to you about
Right.
other complementary therapies, or maybe
Yes.
why don't you try this, why don't you try that. And the multitude of advice which is given.
In that
you get
short period of time.
Exactly, you
Right.
get overwhelmed.
Okay.
So what we do at the Society is we provide two types of counselling. One is medical counselling, which, as Lena said, is done by a
Doctors.
a
Qualified doctor,
a
yes.
qualified doctor. And what we do then is that we go through your diagnosis with you.
Right.
So if you have your reports, etc.,
Bring it along.
just bring it along. And we don't take the place of your doctor, but what
Right.
we do is that we can spend the time with you
Right.
to break it down for
Are you giving second opinion as
No,
well?
No.
we
No.
don't give second opinions.
Right.
What we do is we break down the reports for you so that you understand really what your diagnosis means. We can tell you what is usually given in terms of treatment options. And then if you have questions to ask your doctor, at least you have a better understanding.
Okay.
And we can help you frame the questions that you want. If you have an idea of what you want to ask, but you don't know how to frame it,
Right.
or you want a second opinion, then we can tell you, okay, why don't you ask these sorts of questions
Okay.
so they have a better idea of what it means to you
Right, when they go to
when
see
they go and see their doctor
next.
again.
Okay.
So that's the type of medical support we give.
Right.
In the support aspect, from the peer support, it's really hearing their stories,
Right.
and looking at them.
Right.
I think looking
A
at
lot of
them,
them by
and,
just
and
looking.
seeing them
Right.
interact with each
Yeah.
other, it makes a huge difference because
Okay.
you get the different side then. You get the different side of life with cancer. A lot of people who come are very dejected,
Yeah.
lost, crying.
Obviously, you know, if
Yes,
I were to
sad,
have that
yeah.
kind of news, I
Exactly.
would cry my eyes out, I think.
Because
so-
you don't know what to expect. You don't know what
I know.
Exactly.
Yeah.
Like you said, the first thing will come into my mind is I'm going to die soon.
Yeah.
That's it.
And that's the worst that can come into your mind because now, yes, not in Malaysia, but this is what, you know, we aspire to be. But in other countries, you've got 8 out of 10 people surviving cancer.
That's a lot of
Yes.
percentage.
Exactly.
Right.
So you're having more people live with
After
cancer,
cancer,
or
yeah.
after cancer than
Right.
dying of cancer.
Okay. But it depends on what kind of cancer you have and what
course.
stages that you have,
Of
right?
course.
Okay.
That's what we need to push in Malaysia, though. We have to break that stigma. We have to change people's belief to cancer
Right.
so that we can actually enact more change.
right.
That we can actually make a difference in terms of people coming earlier
Early, yeah.
when they have symptoms.
I think the word here is educate yourself,
Yep.
right? Is that what you guys do over there as well?
Yeah.
Yep.
Yeah.
Right. I mean, you like you mentioned, if you come in with certain kind of cancers, you will always give a support or the support people, the person with the same kind of cancer.
Something they want to see. If you said somebody came in with a cervical cancer, of course they want to see somebody with cervical cancer
Who survive and
who survives,
who-
and then when you see it, it motivates them and
Okay.
say, okay, oh, I
Right.
see, oh, okay,
Right.
and that's how it is.
What about, when they say I'm coming in with stage 4? What kind of advice then you give?
I think advice like that is really saying that yes, you have stage 4. The likelihood is that you are going to die of your cancer.
Okay.
We all have to die of something.
Right.
Yes,
that will
you
be the
are.
reason. Okay.
You are you are going to die of cancer, and yes, maybe your life might be
Shorten a bit. Okay.
but you still have life.
Right.
Yeah.
And treasure it.
Exactly. During that time, there's still things that you can do to either prolong your life, or there are things to actually make your life
A little bit better.
exactly. In terms of symptom control, pain control, etc.
And talking about cancer, what kind of, can you give us a breakdown of the types of cancers that we have in Malaysia, or some of the statistics that we have?
Roughly from GlobalCan 2012, and that's an international survey in terms register on the number of cancers. In Malaysia, we have about 37,000 every year
Okay.
cancers.
Every year.
Every year. So it's
Every year extra,
37,000
yeah,
plus
extra.
37,000
Yes,
every
yeah.
single year. Okay.
So that means it's about 1 in 4 have a lifetime risk of developing cancer.
Okay.
So if there's 4 of us, there's more than 4 of us here.
Okay.
You're looking at one of us. Unfortunately, it was
Already
Lina.
Still can laugh.
We have to
It's a good thing. This is what we want. Positive attitude. Okay. And you were saying, Dr. Sam?
Yes. So it's a high risk in that
Okay.
sense.
Okay.
25% of the population will
Would
have
get it.
cancer.
Okay. But what type of cancer?
Exactly.
That's the question.
The most common cancers overall is, if you're talking about men and women in combined, is breast cancer. Breast cancer is still number 1.
Right.
Okay. Number 2 is colorectal cancer.
Okay.
So colorectal cancer is actually number 2 in men, and it's number 2 to 3 in women.
Oh,
as well.
okay. Right.
Okay. Third is lung cancer.
Wow.
But lung
cancer is number 3.
No, but that's overall. But it's
Okay.
number 1 in men.
I guess it's because of them smoking.
I wonder.
Would smoking be the main reason, the main
Yes.
cause
of
of lung
It is.
cancer?
You're looking at over 85% of lung cancer,
Right.
which is
Because
caused
sometimes,
by smoking.
I'm not talking about men only. We have men, women smoking, and they can say, my grandmother or my grandfather smoked until they die, and they don't have lung cancer. So they say it's just a myth that by smoking you'll get lung cancer. So how many percentage is that a myth, and how many percentage of that is true?
If you're a smoker, you will probably die of a smoking-related disease.
Which includes lung
Which
cancer.
includes
Yes.
lung cancer. Now, smoking doesn't just cause lung cancer, it causes 15 different types of cancer. Now, most people...
Ooh.
Exactly.
15 different types.
Most,
Yes.
most people don't realize that bladder cancers and
Part
kidney
of it.
cancers are associated with lung
With
cancer.
smoking.
With smoking,
I
yes.
see.
And cervical cancer,
Okay.
is also 30% is a cofactor.
Probably because
with
they think
cigarette
it's
smoke.
too far away from the mouth.
Exactly.
So it doesn't relate with smoking.
Exactly.
Probably.
So any cancers around this area, your mouth, your throat,
Throat,
Tongue.
tongue, yes.
Tongue.
all these things are related to tobacco.
Okay.
So-
But lung, like you mentioned, is
Of
number
course.
3 and number 1 for men.
Number 1 for
In
men.
Malaysia.
In
you're talking about
Malaysia.
this. Wow. Okay.
And if you look at the top 10 cancers in Malaysia, or even globally, it's very, very different. Because in developed countries, cervical cancer is not even in the top 10.
Really?
Yes,
Okay.
and it's number 2 to number 3 in Malaysia. Why I say it's number 2 to
Is it
number 3?
Malaysia or Asia or ASEAN?
In some countries it's number 1, but in most countries it's number 2 to number 5.
Okay.
And that's primarily because cervical cancer is actually one of the most preventable cancers out there.
Okay.
It's caused by a virus, HPV. Now, HPV, we now have a vaccination against, which
Yes.
we're doing school programs for
Right.
vaccinations. But you can also do a pap smear to
Yes.
find changes with cervical cancer. Malaysian women don't do their pap smears.
Is it because of awareness? Is it because
Shy.
ignorance?
Yeah, ignorance,
part of it
shy,
is
it's
awareness,
like, yeah.
ignorance.
Yeah.
But
Some
I
of
think
them
a lot of
shy.
it is apathy as
Yeah.
well.
Right, but I think cervical cancer, I think it's only started, to me, I only hear about the awareness about 2-3 years ago, unlike breast cancer
Yes.
and,
yes.
and other
No,
diseases.
Well, yes and no. Cervical cancer actually was the #1 cancer in the 1970s in Malaysia. Yes.
Wow.
And that's when the National Cancer Society introduced pap smears into the country. And that's when we slowly started doing pap smears.
Okay.
And that's why there's a nationwide program for pap smears. You can walk into any clinic
And do a pap
and
smear.
do a pap smear.
Right.
So then you had a slight decrease in cervical cancer. And then, of course, breast cancer started coming up.
Yes.
Breast cancer started coming up more because we're also living longer. So you have different cancers coming up because of longevity.
Okay.
So, yes, breast cancer is something that more people
Are
hear
aware
about,
about.
aware about, because also because there's more international awareness of breast cancer. But cervical cancer is the cancer that you can actually do a lot more even than breast cancer.
Right.
Because we can prevent it.
Right. And I'm actually surprised that cancer, rather than having a cell who just multiply and doesn't do what it says, it's caused by a virus.
Yes. There are many cancers which are caused by virus.
A virus.
HPV just doesn't cause cervical cancer. It causes other cancers as well, also mouth and throat
yes.
cancers.
Really?
In men, it causes penile cancers and anal cancers as well.
Oh.
But the majority of cancers, the bulk,
Okay.
is cervical cancer.
Okay.
So generally, if you have cervical cancer, it's said that you cannot have it in the absence of HPV.
Really?
Yes.
So it links
link.
together.
It links together.
The cause would be
The causative
virus.
agent is the virus.
Okay.
But then you have other viruses as well. You
Okay.
have hepatitis virus,
Yes.
which is linked to liver cancers.
Yes.
So that in itself has a link to liver cancer, but with alcohol and with cirrhosis,
Right.
there's an increased risk to
Okay,
it.
we'll talk about that, but we have to go for a short break, so stay tuned to Hello Malaysia. And welcome back to Hello Malaysia with me, Sue, Lena and Dr. San. We're talking about World Cancer Day. And right before we went for a break, we were talking about how smoking can cause you having cancer. And Dr. San said something very interesting, that alcohol can also be part of the
causative.
reason why you can get cancer.
Yes.
Dr. San.
There are a few lifestyle factors which are linked to cancer. Smoking, of course, is one of the largest. And then you have diet.
Okay.
It's the type of food you eat, what you drink.
Whoa,
which is
diet
linked.
as well?
Exactly.
Oh,
diet is
okay.
linked to about 1/3 of all cancers. Cancers which are linked to diet, like colorectal cancers, your
Okay.
large bowel cancers,
Right.
your stomach cancers.
I mean, things are you eating and things that
What you put
you're not
inside.
eating?
Both.
Okay.
Things that you do eat, high red meat diet,
Okay.
the way you cook your food,
Right.
salts,
Okay.
pickled food, all those things are linked to
Wow.
specific types of
Cancer.
cancers.
Okay.
And then, of course, how you cook your food. If it's very, very high heat, whether it's charred.
Right.
So, I say
How
ayam pencit
undercooked.
and satay,
Right.
because it's charred. Charred foods are linked again to specific types of cancers.
Right.
And alcohol is also linked.
Okay.
People don't realize that, they think that, you just
Consume.
digest it, you consume it, and it just comes straight out again. But it doesn't. At the end of the day, the nutrients, the good and the bad,
Right.
are absorbed.
The
Right,
happy hours
everything-
is no for happy hours.
Right.
And even with alcohol, it's not just how much you consume,
Right.
but it's how early in life you start.
Really?
And whether you binge drink or whether you drink in
What
in-
did they say?
in
I'm just a
constant.
social drinker.
Exactly. But, a social drinker would be someone that you don't drink for throughout the week.
Right.
And then on the
Once
weekend,
you get to drink.
Exactly, you don't stop drinking. And that could actually have a more adverse effect
Right.
than if you, say, had one drink every day.
Is it because alcohol is drying and that causes the cell to react to such a way?
In a way, it's liver toxic at
Okay.
the end of the day. And the liver is what cleans out,
The
it's one of our mechanisms of cleaning out toxins. And so when your liver doesn't work well, of course, then the toxins don't get cleared out. And
Okay.
then, yes, you have linkages to different types of cancers.
Okay. And Lina, would you like to add
Stress
something?
too.
Okay. Would stress
Yes.
gain you
Stress
cancer?
is also the main cause.
Right. Yeah, I
Yes.
mean, you've met a lot of
Yeah.
cancer survivors,
Yeah,
and
because some
patient-
people don't smoke, don't drink,
Right.
and they said actually,
like yourself.
yeah, must be stressed.
Really?
Because stress, unnecessary stress, like traffic jam
Family.
and something. Yeah,
Right.
Sometimes unnecessary. You
Right.
shouldn't be stressing about
Right.
little thing, but and then you say, oh, like this, like that, like this, like that.
Right. But
And
there
it's
are
not
cases
healthy.
where it has nothing to do with your lifestyle, like what Lina had.
Exactly,
Right.
exactly. But I mean, we're looking at
The-
up to 2/3.
the percentage of higher
exactly,
percentage.
about 2/3, and it's specific cancers. Like the cancers that you know you can do things about.
You can
Colorectal
prevent
cancer,
it.
exactly.
Okay.
You know, colorectal cancer is now a rising cancer, and there's a direct correlation to the amount of red meat that you eat.
Okay.
In countries that don't eat a lot of red meat,
They don't have that kind
they
of
don't
cancer.
have cancer. You know,
Wow,
that
okay.
type of cancer.
Okay, okay.
Vegetarian diets.
Right.
You know, those who are mostly vegetarian don't have those types of diets.
Cancers.
Cancers, sorry.
Uh-huh.
So yeah, so there are direct correlations to
There is,
specific
okay.
cancers. So I think the key message is really prevention.
And
How do we
moderation,
prevent?
probably?
Yes.
Yes.
Okay.
Yes.
You don't skip your red meat, though.
No, you
Yeah.
don't.
Okay.
But there is, yes, moderation. But people have different different degrees of moderation. what they-
Big plate, this is my moderation.
Example is
Okay.
buka puasa.
Okay.
Ah,
Oh, you see the amount of food.
The dessert
people eat,
especially.
which is actually is wrong.
Okay.
Yeah.
We should take it as,
Yes.
as normal as possible.
Yes.
Okay.
From this end of the house to the other end.
It's food all over.
It's all food.
So that's what she
yes.
meant by
and also
moderation.
obesity. Obesity now is a growing concern
Okay.
with not just heart disease and diabetes, but it's a growing concern with cancer.
Cancer as
Because
well.
we're seeing a link with
Wow.
obesity and cancer as well.
Okay.
Breast cancer
Okay.
is linked to obesity. Ovarian cancers, yeah. So there are cancers which are linked to
obesity. So
in
basically
itself.
just take care. I mean, the simplest advice would be
Be
take care of
happy.
yourself.
Be happy. Take care of yourself.
That's, I mean,
Yes,
I mean, with that, sometimes we do get it. Like you, unfortunately, you had,
Yes.
by doing everything right, you had it as well. But that shouldn't, tarnish your
No, it
spirit.
made me a better person.
Okay.
Actually, it made all of my friends who had cancer, and you ask them, and they say it made them a better person.
Okay.
Really,
you
really.
enjoy life
Yes,
even
yeah.
more. You
And
appreciate.
You appreciate. You know, when you bathe, you feel. Or before, when you bathe, you didn't thank God for the
right.
water.
Right.
You know, after chemo is a bit hot.
Right.
You know, and you feel your body hot, and when you open the tap and the shower drop on your head,
Okay.
wow, it's really nice.
All right. Now we talked about the cancer. Now let's talk about the medication or medicine or treatment that we seek. You mentioned that alternative do not really go there. Go for the Western medicine. So when you had yours, did you think of going for the alternative medicine, or you just go, okay, let me just have
Because
have
actually,
the
you
operation?
must understand what you want in life.
Okay.
I want to live. I
Okay.
have 4 children.
Okay.
And I had 3 boys and little girl. That girl was, I think she was 13, and I want to live.
Okay.
You see, you must know about yourself what actually you want.
Right.
You want to lay back and say, wait a little while, 10 months, 1 month, 6 months,
Okay.
I don't want. I
Okay.
want to live. So
Right.
this is why I tell them, your choice is yours.
Okay.
Whether you want to go alternative or you want to wait 3 months and what the doctor say. You see, I want
Right.
to live, so 4 days.
All right.
Yeah.
And how early should one get themselves checked whether they have cancers?
Okay. Generally, for most cancers, we say that in your 20s you start looking.
Okay.
But for women, we start at a younger age compared
Right.
to men.
Right.
So when I say we start looking, it's like for breast cancer,
Check for your
where
check.
you do your own self-breast examinations, and then you go and do clinical breast examinations. Later on in life, yes, over the age of 40, that's when you do your mammograms. But say for pap smears, for cervical cancer, you start once you're sexually active.
Right.
Then you should start thinking of doing regular pap
How
smears.
regular is regular?
Times are changing in the sense that we used to say every year or every 2 years or every 3 years. Now actually we're showing that if you get a pap smear done and consecutive pap smears are clear, then you can actually wait up to 5 years,
Okay.
even 10 years,
Right.
depending on your lifestyle as
Okay,
well, of
right.
course. So as we mature,
okay.
I think as well as our understanding of cancer matures, we're realizing that, yes, maybe we don't have to do it so often.
Okay.
But definitely for breast cancer, do yourself breast examinations.
So breast cancer and cervical cancer, it's easy, not to say easy, the examination is easy to do.
Yes.
But what about, whether we want to know whether we have internal kind of cancers where you need
more
biopsy.
difficult. Exactly.
Yes.
But somehow your body will show a symptom or
react.
sign. Yes.
I think one is prevention. The two is knowing the symptoms of cancer,
Yeah.
being
Okay.
aware of the symptoms of cancer.
Like you notice that there's a bump on
your body
leg,
tend to give you a signal.
which
You know,
is
if something is not right. Something is not right
for
in the
you.
body.
It was the bump,
Yes,
or was
yeah.
it something
Yeah,
that
I feel something is not right.
Okay.
You know, but I didn't know what was it. you
Right.
see. And later the bump was coming. It's only take me 6 weeks for the
Right.
bump to grow very fast.
Okay,
And the
yeah.
thing is that people think that cancer is supposed to be painful
Yes.
or debilitating straight away.
Right.
That you have cancer and bam, you're ill straight away. But it's not. As
Right.
Lena said, it was not painful.
Not painful
Okay.
at
And
all.
most early symptoms of cancer
You don't feel
are
the pain.
innocuous. Exactly.
Right.
They're just things that you might have all the time. A cough.
Okay.
And you don't associate just
Coughing
cough
with
with
cancer.
cancer, with lung
Yes,
cancer.
yes.
But if it's a persistent cough, which goes on and on and on, then yes, you should check.
Right.
Discharge, of course. Sometimes you just think it's an infection,
Right.
and you don't associate it with cancer or diarrhea,
Right.
or like for ovarian cancers,
Right.
people think they're putting on weight, that their stomach is just growing bigger and bigger,
I
or the abdomen is growing
Right.
bigger and bigger, and they're putting on weight.
Right.
Um,
Or just, I think by knowing yourself, for example, if you're a smoker, you should get yourself checked regularly, something like that. Should I go and check all my lungs and something like that?
Well,
Stop smoking. That's the best answer.
Exactly.
Well,
I
people say,
think,
I'll stop smoking next year or something like that. They will say, but they don't, obviously.
Yeah,
but
that's true.
if you know that you're high risk of having cancer,
Exactly.
what can you do?
I think that's the other thing, is knowing your personal risk.
Okay.
Is understanding what your personal risk is, and then doing appropriate checkups.
Okay.
So then, yes, if you're a smoker, then if you do have a persistent cough, you should be thinking along the lines that it could be due
The
to
lungs or the throat.
Exactly.
Right.
But there's for other things where you don't have to be ill to get checked up,
Okay.
which is your breast cancer, your cervical cancer, your colorectal cancer. You can actually do what we call a FOBT, which is just checking your stools for blood.
Right.
And
And it's easy. You can go to any clinic and any hospital.
And it's not expensive.
Okay.
Doing a pap smear is not expensive.
Okay, let's talk about all this treatment and what kind of medical treatments that we can get from National Cancer Society. But we have to go for a short break right now. So stay tuned to Hello Malaysia. And welcome back to Hello Malaysia with me, Sue, Lena and Dr. Sound. And we are almost to the end of the program. But before that, I want to know what National Cancer Society Malaysia has to offer to people who seek treatment or seek help.
Okay. For those in terms of early detection and prevention, we have clinics. So we have a health cancer screening clinic where you can come and do your mammograms, you can do your pap smears, so it's breast and cervical cancer screening. We also do prostate cancer screening and colorectal cancer screening. We have a diagnostic centre, and that's for people who have cancer,
Right.
who need to check up a little bit further. Your doctor will tell you whether you need to come to that or not, and that's
Right.
a nuclear medicine centre.
Okay.
We have also a children's home, where we have children who have cancer.
Wow.
Who
That
stay,
would be heartbreaking.
Yes.
Okay.
but children are wonderful in the sense that when they're ill, yes, they're ill, but when they get better,
They start
it-
laughing and
exactly.
smiling.
Nothing,
There's
they're
nothing wrong with
inspiration.
them.
Exactly. So we have a home there that people, children who have cancer, can come and stay in while they seek treatment at Hospital Kuala
So there's a
Lumpur.
stay-in program as
Yes,
well over
there
there?
is.
Okay.
And then we have the Resource and Wellness Centre.
Okay. And
We-
what's the wellness is all about?
No, Lena.
You're
Lena is
part of the
it.
support team.
We get walk-in. We get people, women with cancer walk in, and then they'll ask questions, and then we have, we offer them what actually they want to know. We have long stretch of library if they want to read any book, any type of
research.
cancer is
Then
there.
your complementary therapies.
Yes, complementary therapy. We have
Really?
yes, we have yoga. Is it yoga? And laughing yoga. We have yes.
Okay.
And also we have classes for them.
Okay.
Cooking classes,
This is
makeup
to lift
classes,
their
and
spirit.
it's all free.
Oh,
Qigong,
Yeah. Oh, Qigong,
Chinese
yes.
ink painting.
Chinese
right.
ink
So all
painting,
you have to do
Qigong.
is just go in.
Yes.
Yes.
Right,
And
make
we'll
sure that,
show them. You say we have this class on certain day, this class on that day. You can come and join us.
right.
If you
And
can come,
if that's free, what about the treatments? Do they need to pay some amount of money?
Yes, in terms of the clinics that we have, you have to pay for the services, but they're highly subsidized.
Okay.
So if you look at what we offer, we're usually about 30 to 40% cheaper
Yes.
than most private centers. However, we have programs for the underprivileged.
Yes.
So for the programs for the underprivileged, that's free of charge.
Really?
Yes.
So what do they need to come up? I mean,
We usually
bring
work
in?
with communities.
Okay.
Where the community leaders will come and say, okay, we have these group of women or we have this group of men. And then we will go out, we will do programs with them. So we educate, we create awareness in that area. And then for those who are high risk, then we bring back to get checkups.
And treat them.
And treat.
Okay. And I think we are almost to the end of the program. And Lina, I think you would like to give some advice to the people who just receive the bad news or,
Okay.
going through their treatment. What would you like to say to them?
What I want to tell them is that there is life after cancer. It's not death sentence.
Right.
And just look at me. I'm sitting here and
Laughing,
telling,
enjoying life.
Yes. Look at the other side. People have dengue, unfortunately, 2 weeks, 3
Right.
weeks. But cancer, no.
Right.
You see people with cancer 20 years, 15 years.
For survive.
Yes. So pick up your pieces. There's nothing wrong. It's only
Right.
cancer.
Right. And come into, if they need help, they can always come in to
they
the
can.
National Cancer
Yes,
Society.
they can come to us and
Right.
and call us. Yeah.
Or they can call us. Okay.
Yes.
And Dr. Sound, any advice or anything you want to say to people out there?
I think my advice is that cancer is a community fight.
Okay.
It's not a fight which is by
You're on your own.
doctors,
Yes.
it's not a fight that just starts in the hospital. It's a fight which starts at home. It's at home where you need to be aware about cancer, you need to do something about it, you need to take the first steps
Right.
to change your lifestyle so that you can prevent cancer.
Okay.
And actually take the first steps as well to overcome the fear of cancer.
Okay.
So that you can actually go to the doctor, do your checkups,
Right.
and if you do find any symptoms which might be associated with cancer, take that step to the doctor immediately.
Right.
Don't wait a month. Don't
Right.
wait
Let
2
me
months.
think about it. Don't
exactly.
do that.
Exactly.
Okay.
And that's where it makes the difference. If you can take those first steps, it makes a huge difference
To your life.
to your life, to the stage that you find the cancer,
Right.
and the success that we have in treating your cancer
It's
and
higher.
you surviving.
Yes.
Exactly.
Okay. So if they need more information, where can they go to? They can go to www.cancer.org.my.
Yes.
Right?
Or you
they
can pop into our
to
center.
Right, and probably see Dr. Sound over there.
Yes,
or
or
Lina.
Lina.
Right. Okay. Thank you so much for tuning in to. Thank you so much for being here with us.
No,
Thank you,
thank
Dr.
you.
Sound. Thank you, Lina. Thank you so much to tuning in to Hello Malaysia. And until we meet again real soon. With that, I'm Surati Sanusi. Thanks for watching and goodbye.